And we're live. Hello, and welcome to Time of Death. I'm your host, Dee.
And I'm your host, Ris.
And Ris, our next investment is going to be one of those clapping things. Action.
I'll do it for you. Action.
We're live.
We're live.
So today we're going to be putting on some of our hats. A hat I no longer really ever wear. But I'm sure Ris wears a lot. And that's can you guess? Respiratory therapy hat.
Well, I'm not a respiratory therapist, so I never wear that.
You still do stuff with the RTs.
I guess I do work with RTs. That's true.
My favorite RT, Jennifer, I miss you. You probably don't even know about this podcast, but I still love you and I still miss you. It's been like 5 years, but it's fine.
Thanks, Jen.
Thanks, Jennifer.
So if you are new here, welcome. We are two nurses that love to talk true crime. We like to focus on cases that have a heavy medical influence to them or cases that feature a medical professional as the perpetrator or the victim.
So let's get right into it. Thank you for the induction. Thank you for the introduction, Ris.
No problem.
Ironically, the individual we are discussing today also shares the same name as my favorite respiratory therapist I used to work with, which could probably be confusing for a lot of people. Just to be very clear, I did not work with this Jennifer. This is Jennifer that was doing RT things back in 2002 when I was in second grade. So, no, this is not my Jennifer.
Okay. So from here on out, we're not going to be referring to Dee's old RT favorite.
Yes. Yes. So, as today, we are going to be talking about the disturbing case of Jennifer Hall, who, again, was also a respiratory therapist. It's a very small world full of a lot of irony. But this Jennifer was accused of poisoning her patients with lethal drugs while working at Hedrick Medical Center in Missouri.
Wowza.
This case is an example of when trust in healthcare professionals completely breaks down. I read this and it was just devastating. The patients at this facility were on the mend when suddenly they just deteriorated out of nowhere. They had sudden and unexplained cardiac and respiratory arrests. And what was the common factor, you might ask?
Jen, the RT.
Jennifer RT. Jennifer Hall RT. It's a bad bunch of apples. Not RTs are bad apples. Or Jennifers, who are RTs, are bad apples. But rather, Jennifer was just so bad, she ruined the barrel of apples.
Yeah.
She was so bad, she just couldn't be one apple.
She had to be a whole entire barrel to handle all that bad.
I think that apples are supposed to be in bushels.
Yeah. What did I say?
No, I'm throwing a fact out there. So I should say a barrel full of bushels of apples.
Dang, she ruined a whole barrel?
Yeah.
So multiple bushels.
Multiple bushels.
That's how you know it's bad.
So a bunch of barrels of bushels of bad apples.
So multiple barrels even?
Multiple barrels.
Oh my gosh.
It's a bad mamma jamma. So let's talk clinical for a moment before we start getting into semantics of wordplay. Mm-hmm. Between December 2001 and May 2002, a noticeable spike in, quote, cold blue emergencies occurred in the Hedrick Memorial Center Hospital. What's the code blue, Ris? Do you want to give them some background? So when people hear code blue, what does that indicate?
Code blue means someone has arrested. So usually it means that their heart and or their lungs stop working properly and they need to be resuscitated.
Well said. So it would make sense then for Jennifer, as a respiratory therapist, to be present during these emergencies then, right?
For sure.
So we talked about this being sudden, unexpected, unexplained. The most suspicious of these cases involved 75-year-old Fern Franco, who was recovering from pneumonia. If you don't know what pneumonia is, it's an infection in the lung. So she was doing really well when suddenly out of nowhere, she had a cardiac arrest.
Mm-hmm.
The hospital later discovered traces of succinylcholine, which is a paralytic drug, in her system. But
That's not good.
no one had ordered. No doctor, no whoever had ordered that medication. So tell us a little bit about succinylcholine, Ris.
Succinylcholine is a paralytic, and we often use it when we're intubating people. For those of you who don't know, intubation is when you stick a tube down someone's throat so that they can breathe, basically. While they're doing procedures, or if someone can't maintain their own airway, we intubate them to keep it open for them. Usually we give a sedative, like etomidate is a common sedative we give before we give succinylcholine, because it literally paralyzes your body.
Mm-hmm.
And it paralyzes your muscles by interfering with acetylcholine at the neuromuscular junction. And like I said, it's used for intubation, but if it's given without, properly ventilating patients and making sure you're breathing for patients, because they can't breathe on their own when they're paralyzed. If you're not properly ventilating them, then they're going to have a respiratory arrest for sure.
So basically, you cannot breathe on your own. Paralyzes that part of your body.
Yeah, and the reason why we give etomidate or another sedative before we give the succinylcholine is because it can be really scary for patients, because they literally can't move their entire body. They can't breathe. They can't call for help. They're just stuck. And it's, it's a horrible way to die if it's given for nefarious reasons.
And so you would be aware of what's going on.
Yeah.
Even as it's given. It doesn't put you to sleep. It just paralyzes you.
It just paralyzes you. That's why you need a sedative, because that makes you unaware about what is happening.
Exactly. So like Ris said, that was perfect. So yeah, it's an awful, awful way to go. This is what made Fern Franco's death and several others very concerning, right? Succinylcholine isn't something that just slips into a patient's treatment accidentally.
Mm-hmm.
The drug causes rapid paralysis, and without immediate respiratory support, like Ris is talking about, it's lethal.
So here's a little tidbit. Back when I got my tonsils out, I had a tonsillectomy a couple years ago because I kept getting strep. And they gave me succinylcholine. Do you remember this, Dee?
You Brady'd.
And my heart rate dropped. So they had to give me the antidote to succinylcholine.
Your body said, no.
I wonder how low I got with my heart rate.
What's your resting heart rate?
Like 70, 80.
That's high.
No, it's not. That's like normal.
Mine's in the 60s.
It's not a contest.
I even took mine at rest the other day and it was 66.
Yeah, because you're resting.
I also don't have an Apple Watch, so I don't check it all so often.
Yeah, I check mine. You should see me at work.
Because probably shooting up to 200s yourself.
No, the highest I probably got is like 140 at work.
Oh, God.
But that's if I'm moving.
Shaking.
That's if I'm really moving.
Mm-hmm. So succinylcholine is something that, as a respiratory therapist, Jennifer had access to, as well as other drugs. Another drug that was found in some of the patients' tox screens was morphine. I'm sure more people are familiar with morphine than acetylcholine, but morphine can cause something called respiratory depression, especially in patients that don't have opioid tolerance or have an underlying compromised respiratory function. So like things like COPD, asthma, anything that's affecting your airway, morphine would be contraindicated. However, by showing up on toxicology reports, they had been given it, but it was never prescribed for any of these patients.
Mm-hmm. So let me just, jump in really quick. Currently, when we intubate, the nurse is the one who gives meds. RT gives like breathing treatments, but I've never seen them give any IV meds, and I don't believe that's in their scope. So I don't know if maybe back in the day, this is from the early thousands, that maybe it was different back then, but it's very rare for them to have, they shouldn't have any contact with succinylcholine or morphine. But, maybe it was, laying around where it shouldn't be, but, or maybe like during a code, it was swiped or something like that. I don't know, but currently they don't deal with any IV meds.
So what's hard is determining, like, because we are in a different state other than Missouri, the scope of practice is going to vary from state to state. It's state to state specific. So in Missouri, it does say that they can administer medications, specifically inhaled medications like aerolized medications, NIPS, and that's essentially just medications that are you inhale.
Yeah, that's how it is now. Like RT can give breathing treatments and that kind of thing, but I've never, ever, ever seen them give any PO or by mouth meds or IV meds, any other kind of med besides these, specific to breathing meds.
So it's confusing because even in California, it did say that that was a state that respiratory therapists can give IV medications that are specifically for respiratory care, and that would fall under their scope. So again, it's really unclear whether or not this fell in while she is practicing in Missouri or was practicing in Missouri, that this would fall under her scope. And it could be the fact that a lot of these medications are given in code situations. Even if she wasn't the person that was pulling or administering, she would have had some kind of access to them.
Yeah, definitely exposure to it because it's being done with her in the room. You know what I mean? But I can't say for like what it was like in her state back in the early thousands.
And I just want to circle back really quick. Morphine is incredibly dangerous, especially in the elderly population. And again, with pre-existing respiratory conditions like COPD. This will lead us into another patient who died under suspicious circumstances, Koval Gan, who had COPD. He was recovering at that time, but he also experienced an unexplained cardiac event. While morphine has its place in pain management, in this context, it would have significantly worsened his respiratory status, which ultimately led to his death. So, these are just two instances, but it's very frightening to see just how easily these drugs can be misused, especially when you have a healthcare worker who knows exactly how and when to administer them. And just by saying that, you're assuming that they're administering them appropriately. Jennifer, as a respiratory therapist, had the medical knowledge and know-how to use acetylcholine and morphine in waves that were fatal, and she had access to these meds. Here's the thing. Jennifer was on duty during an alarming number of these, quote, code blue incidents. The hospital had noticed the pattern, but just didn't act fast enough, which seems to be a reoccurring theme as well on this podcast. It wasn't until years later, after multiple suspicious deaths, that authorities finally reopened the case and charged her with murder in 2022. So over 20 years later.
That's crazy.
The prosecution focused on the timeline, the patterns. They argued that Jennifer intentionally administered these meds to cause respiratory and cardiac arrests, targeting patients who were already incredibly vulnerable. Vern Franco's death became the cornerstone of the case against Jennifer because of the clear presence of succinylcholine. That med, under no circumstances, should have been given to that woman. But it just wasn't the one patient. It wasn't just Vern. It was Koval Gan that we mentioned, the gentleman with COPD. Other victims included John Olds. And what's really terrifying about this is that we may never know the real amount of victims. There were an unknown number of other people who experienced similar, sudden, unexplained, total decompensations while under Jennifer's care. None of these patients were expected to die, and most were actually improving until they just took a turn for the worse. So Jennifer has maintained that she's innocent. She claims that she's a scapegoat by the hospital after an earlier lawsuit was made. The administration became very wary of any type of malpractice claims. She also pointed out that the hospital's record keeping was questionable, which made it harder to prove when and where certain meds were administered. Just playing the devil's advocate, yes, it could make things harder to determine when and where they were administered, but that also could have worked to Jennifer's benefit if there was an issue with record keeping, because then it becomes, okay, if the records are not accurate, this isn't a way for her to take advantage of the situation.
And it's like an excuse,
Mm-hmm.
you know?
But the clinical evidence and patterns of the deaths just really are very damning. Succinylcholine and morphine aren't just like casual drugs that you mix up in standard care. They require strict administration protocols.
Yeah. I still think it's weird though. Like, I could see her, maybe being responsible for succinylcholine because we give it to intubate people. But morphine, I wouldn't see any situation where the RT would be the one to give the morphine. You know what I mean?
Well, it's interesting because I know that morphine can also help with like respiratory, like air hunger, like if someone, I wonder, and you would know better, do they ever give morphine if someone's like bucking the vent or anything like that to kind of just try to?
Currently, no, we don't give it typically. No, normally we use sedatives like propofol or some, benzos like Versed drip. You could use, if you want to talk like a pain management type thing, we give fentanyl. Fentanyl. Also, fentanyl doesn't really affect your BP, your blood pressure. So we give that one commonly, especially with propofol, because propofol will drop your pressure. But morphine, not really. No, I don't think I've ever given it to an intubated patient. But I don't know if it was different back then.
Could be. It could be. And, the standard of care has changed, I'm sure, over the last 20 years.
Yeah.
So, but the impact on families of patients like Fern Franco is just immeasurable. The latest update for the trial is that Jennifer went on to plead guilty August 2023 in the deaths of 2 patients. She was sentenced to 18 years by the Missouri Department of Corrections with the possibility of parole.
How much?
18 years.
Wow.
So she was initially charged with 2 counts of first-degree murder, but pled guilty to get the charges reduced to first-degree involuntary manslaughter for the deaths of Fern Franco, as well as David Wesley Harper, who was 37 years old. She also pled guilty to 1 count of second-degree assault. So in total, there were 9 patients who died at Hedrick Medical Center in Missouri over several months in 2002 that were considered medically suspicious. However, has only been charged in 2 of the deaths and 1 assault.
She assaulted someone?
That's what she's claiming.
Okay.
But that's all I got.
I'm going to get this guy out of here. Very good job, Dee. I didn't hear about this crime before, so good job finding that one.
Thank you. Very obscure. but I'm glad justice was served.
Very obscure, very mindful.
Very demure, like the cat. Before we end, I just want to touch base about the tragedy that's going on, specifically like Tennessee. I know that I think it's Asheville, that it's just the town is completely decimated by Hurricane Helene. During this time, we've shared on our Instagram, there's been several nurses who are just missing right now. A lot of travelers, and obviously there's also a lot of people. But, I just want to let everyone know that anyone who might be having a hard time right now, displaced, impacted by Hurricane Helene, we are thinking about you guys. We are praying for you. We're doing what we can on our end in terms of in our state. But, we just wanted to give a quick shout out for all of everyone, not just nurses, who've been impacted.
Yes, our thoughts are with you guys during this horribly tragic time.
Yes. Because there's like travelers who are, and I'm not sure it's not just nurses, but again, we're both nurses. We both really, it strikes home. It really hits home because, we have loved ones who do travel contracts, friends, colleagues, coworkers. So we hope that everyone is okay. Everyone's found safely. But, special place in our heart for some of these travelers who don't have anybody looking for them, maybe family or out of state or,
Yeah. And all the healthcare workers that are there currently and, doing their best to care for these people, especially when their own families might be at risk. So
absolutely. And we also want to thank emergency personnel in these, the ED workers, EMTs, firefighters, police, everybody, even just volunteers who are out there, out in the rough and tough of it.
Yeah. I can't imagine how difficult it is for all of you right now. Yeah. So our thoughts are with you guys.
Absolutely.
Okay. So we will see you next week, and everybody stay safe out there and have a good day.
Bye. And then we'll play let's call it. What time is it, Ris?
1850. The time is 1854.
That's 6:54 for all you non-medical, non-military folks.
And tune in next week. Bye.
Bye.
If you enjoyed this episode today, feel free to like us, rate us, review us, follow us, or do anything else to us that might help encourage others to listen.
Oh my God. Did not come out the way that you thought it was going to come out.
Bye.
Bye.